This month, Gabriela Rodrigues from our audiology team has teamed up with Nicole Miller, an audiologist and lyric clinical trainer with Phonak, to bring you a special presentation. Together, they will explain what the lyric device is, the appropriate candidate for the lyric, and what audiologists have learned over the years while fitting patients with this state-of-the-art technology. Without further ado, I'd like to turn it over to our speakers.
All right. Hello, everyone. Thanks, Chelsea, for introducing us. I'm Dr. Rodrigues from Shohet Ear Associates. We're super thankful to have Nicole Miller with us as well from Phonak Lyric. We're going to move through a few different things, but first I just want to introduce Shohet Ear Associates and some of the things that we do. So we are a practice made up of both medical doctors and audiologists. Team of audiologists, we work on all diagnostic testing. So hearing tests, balance tests, different brain function tests, as well as work on hearing aids, cochlear implants, middle ear implants, tinnitus, and some custom swim plugs, lots of different things. And then our medical team focuses on hearing loss, implants, vertigo, swimmer's ear, surfer's ear is a big one here, facial nerve disorders, and a few other things. So we're thankful to be a part of a very comprehensive team that we all work together to kind of go through all of these different services. But today we want to focus on extended wear. We've done a talk about this a while ago, but we just want to revisit, talk about some of the things we've learned, and talk about who might be a good candidate for something like this. So first, I just want to talk about who experiences hearing loss or tinnitus. If you experience one or the other or both, you're probably not the only person you know, and definitely not the only person dealing with something like that. About over 400 million people suffer from hearing loss, and that number is only projected to grow in the future. So that's a lot of people experiencing something similar maybe to you or someone you know. About 50 million Americans also suffer from tinnitus, which is also a lot of people. So whatever you're going through, you're probably not the only one, and hopefully we can find something to help with that. Those numbers translate to about 1 in 10 people experiencing hearing loss, which makes it one of the most common health issues. Also, 31 million Americans. So that's just another huge number to show that you're not dealing with this by yourself. And then, like I said, about 50 million Americans suffer from tinnitus. So how does that work? What does that mean? And what is going on? I want to touch briefly on some parts of the ear and what that might mean for you or someone you know. So before we talk about hearing loss, I just think it's important that you understand how we hear and some of the structures that deal with hearing and balance. So let's take a couple minutes just to review. This might be a review, this might be new information for some of you, but let's kind of work through this. So our ear is composed of our outer ear, which is your pinna, what you can see, your auditory canal up until your eardrum. Once we have our eardrum, through our middle ear, that's composed of 3 little bones that's sending the sound to your inner ear. Inner ear is made up of both hearing and balance organs. So your balance organs right there is the semicircular canals. And then your hearing organ is the cochlea. Both are sending signals to the brain through your 8th nerve, which is your auditory nerve. So that's why a lot of times if you come in for balance problems, we might give you a hearing test or vice versa, because we want to know how the whole pathway is working and where the issue might be happening. There's 2 different kinds of hearing loss. We have conductive hearing loss and sensorineural hearing loss. And we determine what kind of hearing loss you have based on where in the auditory pathway you might have blockage or damage. Conductive hearing loss is caused by blockage in the outer or middle ear. So from what you can see through the middle ear with those little ear bones. Things that conductive hearing loss might be, could be an ear infection, fluid in the middle ear, wax in the ear, the outside canal there, any injuries to the eardrums or any malformations to the outer or middle ear. Conductive hearing loss can occur when sound is not being conducted the way that it should be through the outer and middle ear. So the little bones in your middle ear are called the ossicles, and that is what is sending the sound to the inner ear, like I said earlier. A lot of times, conductive hearing loss can involve a reduction in sound level or the ability to hear very soft sounds. Sometimes, dependent on what's going on, this hearing loss can be corrected medically. So that could be, a medication or surgical intervention, but oftentimes than not, something going on here, we can probably get in there and offer some sort of help. If it's not able to be corrected medically or surgically, then there's lots of different hearing aids and hearing options to kind of restore the hearing. The second kind of hearing loss is sensorineural hearing loss. And that is caused to damage in the inner ear. So the cochlea itself, or that eighth nerve I mentioned, going to the brain. Things like this can just be, I like to tell my patients, getting a little wiser with time, but just some age-related hearing loss. This is where your damage is. This can also come from exposure to loud sounds or extreme noise, different genetic disorders, different infections that may impact those inner hair cells in the cochlea. And this really is a loss of the ability to hear soft sounds. And specifically, a lot of times, really the clarity of speech is lost here. Conductive hearing loss seems to be a volume issue a lot of times. Sensorineural hearing loss is really a clarity issue more often than not. People often say that sound is muffled or unclear, different things like that. Hearing loss in general is not one size fits all. Everyone explains different things to me about what they are experiencing. Their family members might notice changes in their behavior. So it's not a one size fits all. And I think a lot of people have maybe that thought in their head that, oh, I hear just fine, I don't have hearing loss. But hearing loss looks a lot of different ways. And we're not only concerned with how you're hearing, but we're concerned about other structures as well. Tinnitus as well can be accompanied with hearing loss or independent. This as well is not one size fits all. It's not always, bells and whistles in the ear. It can sound lots of different ways, and different people experience tinnitus a lot of different ways. Most of the time, it is a sound that you're hearing or perceiving when there's no actual external sound going on. Lots of people say buzzing or hissing or whistling in their ear. And my favorite thing is when people come in and say that they always ask their wife, oh, what is that high-pitched ring? And their wife doesn't hear it. That might be tinnitus, might be time to come get a hearing test if that's what you're experiencing. But like I said, we are obviously concerned about hearing loss, but we are concerned about your overall health and well-being, and hearing loss is a part of that. So we want to know that your brain, your ears, all the structures are healthy, and we want to know that we're doing everything we can to keep them that way. A big part of hearing loss is your cognitive well-being. The brain plays a very crucial role in hearing loss and how you hear, but that also means that hearing loss that goes untreated can play a role on your brain. So lots of research connecting untreated hearing loss to overall brain health and brain function. Lots of studies going into deep diving into this right now, but a really good statement that I like to use with my patients is from neurologists at Johns Hopkins in Maryland. And they said, they quoted, "Brain scans show us that hearing loss may contribute to a faster rate of different cognitive decline in the brain. Hearing loss also contributes to social isolation, and you may not want to be as people with much. And when you don't want to engage in conversation, these factors can lead to dementia, Alzheimer's, and different cognitive effects. So just as important to know what the brain is doing with hearing loss as it is to know how you're doing in conversational speech. About 71% of hearing aid wearers report an improvement in life overall. 74% of hearing aid wearers report improvement in relationships at home. I always joke that I'm also a marriage counselor, so I think that one's a big one. And 67% of hearing aid wearers report an improvement in self-esteem. So this is more than just hearing aids and hearing loss, but overall quality of life is a big focus. So when we have a hearing loss or tinnitus present, what can we do about it? And you have some options. These options include behind the ear hearing aids, receiver in the canal hearing aids, in the ear hearing aids, and then an invisible hearing aid, which is what we're focusing on today, which is Lyric. In our office, we do not believe that there's a one size fits all. These are very fine-tuned and very tailored to your lifestyle, your hearing loss, your budget, what's important to you. So we really like to take the time to best understand what is the best option for you. The best hearing aid is one you're going to wear. So that is a big focus for us. But I have a lot of people that like to kind of experience different options. And I've had lots of people really desire an invisible hearing aid. So I want to turn it over to Nicole so she can go into detail about that with y'all.
Hello, everyone. So we have conducted surveys, and it has shown that 62% of people desire an invisible hearing aid. So something that doesn't show at all. Phonak has Lyric, and Lyric is the only invisible hearing aid on the market that's 100% invisible. So what is this little device? What does it look like? So as you can see, it's this little yellow hearing aid here, and it is 100% invisible. It sits deep down in the ear canal. It offers clear, natural sound quality. There are no daily hassles, so you don't have to worry about charging the batteries or taking the batteries out and replacing them weekly. And it is a great option for tinnitus as well. So we know that 88% of Lyric wearers said that they really feel they can live a normal life once they have been fit with the Lyric. They can connect to devices. So if you have AirPods or any Bluetooth headset that you use for work or just to hear on the phone, you can use that with your Lyric. There, as we said, there are no batteries to change, and you can even fall asleep with it without having to worry, oh my gosh, I have to take my Lyric out or hearing aid out. You don't have to with the Lyric. So these little devices are programmed and fit by a highly trained professional. So all of the providers at Showit have taken about 16 extra hours to be able to fit this device for their patients. It does not require any surgery or anesthesia. You walk in, they size you, see if your ear is a candidate for it, which we'll go into further. And then you will walk home out of the office that day hearing. It is something that is worn for about 2 months at a time. So like I said, once they place that device in your ear, you are hearing 24/7. It lasts about 2 months on average. It is purchased on a subscription basis. So not everyone can offer Lyric. So as I said before, the providers at Showit have taken additional training in order to be able to provide this for you. And there are over 20,000 hearing clinics, and only 3% of them have lyric in their office. Showit was actually one of the first offices to ever have lyric in their office and be able to provide it to their patients. So let's dig a little bit deeper on why this is so good for you and why it sounds so natural. So like I said, it is invisible, but it is so invisible that it's fitting about 4 millimeters from the eardrum. So it is placed deep down in the ear canal, which allows sound to be collected and directed into the tympanic membrane, as Gabby was describing, the middle ear, so that it sounds more natural and it picks up more of those natural and spectral speech cues. It is an analog hearing aid, so analog technology is actually a very clear signal. It is not digital like all of the other daily wear devices out there. A lot of people report that their own voice sounds natural. When I was fitting the device and in practice, so many people would just say, everything sounds so natural. It sounds like what I remember hearing used to be like. Their voice sounds natural, and it's all because the natural anatomy of the ear is being used, even in background noise. Because it's placed so deeply, we have the pinna that will help reduce background noise for us as well. It also improves localization. So compared to traditional hearing aids, people report better ability to localize where sound is coming compared to traditional hearing aids. So again, it is the only device out there that is 24/7 that you can hear at all times, even while you're sleeping. And as Gabby was talking about the role that we know that hearing loss and cognition and its effect on cognition play, it is the only device out there that will give you that 100% hearing 24/7, which will improve cognition. So it's also great for tinnitus relief. Again, that auditory nerve is being stimulated for 24 hours a day. I know when I was fitting hearing aids, a lot of patients with tinnitus would tell me, these work great, my hearing aids work great during the day, but as soon as I take them out at night, my ringing is back, and that is really when it bothers me, is because I'm trying to go to sleep. So a study was done and shows that it reduces tinnitus annoyance faster than daily wear hearing aids. It provides a greater relief with tinnitus. It improves sound quality, sleep quality, because you're not being bothered by this other noise. So who is a good candidate for this? A lot of people are. So anybody that is active and wants something hassle-free, doesn't want to have to mess with putting hearing aids in, changing batteries, charging batteries. They want that 24/7 hearing and something completely invisible. And those tinnitus patients, this makes a great option. It is also really good. It fits a wide variety of hearing losses as well. So it fits about a mild to even moderately severe hearing loss. People that may not be a great fit for this is anybody that has had any middle ear issues. So tubes in the ears, surgery on their middle ear, a hole in their eardrum, a lot of middle ear infections. Anybody that has had radiation treatment to their head or neck, this is including even if it happened 10 years ago. We don't want to put the lyric in their ear for that. It can compromise the ear's ability to heal. Some people's ears, unfortunately, are just too small, or the shape of them is just not conducive to fit with the lyric. We also, if somebody needed MRIs, like monthly, very frequent MRIs, we wouldn't want to use the lyric. MRIs once or twice a year, that is not a problem. They would have to be removed prior to that MRI. We also want people to be in just general good health. So any health conditions that are uncontrolled, like uncontrolled diabetes, autoimmune issues, if they're on blood thinners that cause them to bruise easily and bleed easily, they would not be a good candidate for the lyric. But as we said, you can wear this while you are hiking, climbing, riding your bike, wearing helmets. I know when I was in practice, so many people, I live in Denver, Colorado, and so many people would talk about how they hate how the wind is bothering them when they're riding their bike with their helmets. So you don't have that issue with the lyric. You can shower with it, so you can hear in the shower. It's great for work, hands-free, nobody sees it. And sleeping. So if you have small children, grandchildren, just overall safety at night, you can still hear while you're sleeping. It's great for masks. I know we're moving a little bit away from that, but they're still there. So it is great for that. You don't have to worry about your hearing aid falling off when you remove your mask. So we've also done studies and they have shown that lyric patients are happy patients. We know that 96% of them are happy with the sound quality. 86% are very satisfied, and over 90% recommend them to their friends and loved ones. This is just a study that shows a little bit more, but a couple of them, 99% of them are happy with their hearing professional and the services that are provided. Over 90% said that it improves their quality of life. 92% say that they're going to renew their subscription. All right, so we want to open it now up to questions. If anybody has any, Gabby and I would be happy to answer those for you.
Yeah, we have a couple. We got your questions as you guys were typing them live, so thank you for doing that. We have a few here. The first one is, does the ear dry easily after showering? And yeah, I haven't had any patients really have issues with this. I always advise people, don't tip your head and let water drown your whole ear, but it really shouldn't be too big of an issue. And of course, the lyric's never bad for you if it gets wet. People think, oh, is it going to like shock me or something? Nothing will ever happen. You could see your device dying a little sooner than later, but nothing should happen to the lyric. Is that correct, Nicole?
Yep, I completely agree.
Perfect. Second one is, can I take the lyric in and out on my own? And out, 100% yes. So you are given a little tool, so you are perfectly equipped to take the lyrics out on your own. Some patients prefer to do this when they know they're going to come in for a proactive removal, just to give their ear a little bit of time to dry out and rest before the new lyric gets put in. Some people like us to do it. That really is kind of a personal preference. And Nicole just shared some exciting news about putting lyrics in. I'll let her kind of answer that part.
So this has been approved for other countries, that self-insertion, and we've already been able to do self-removal, but they are working to get that FDA approved in the US. So they're currently working on that right now.
Yeah, so maybe someday you'll be able to put lyrics in on your own, but for now you'll have to come visit me. Our next question is, can I use headphones with lyric in? And yes, 100%. That's one of the perks to lyric, is you can pretty much act like it's not there. So headphones are perfectly fine. And lots of patients really like that, especially for our more active patients. Another question is, how much does lyric cost and how much is the subscription? That one you'll have to come in and we can chat about that because it's a little bit different. But the subscription is what's different from other hearing aids. So you're paying yearly, and that includes, as many lyrics as you need in a year, which is the nice part. So if you do get it wet in the shower, that's okay. You get to come in, get a new lyric, and it never is an out of pocket cost for you.
The other benefit too is if there was an advancement in lyric or a new product that came out, you would be able to get that within that subscription. You wouldn't have to wait for another year. You're just kind of grandfathered in.
Absolutely. If there's any other questions, we'll have you type those now. We'll wait a couple minutes.
All right, you guys, looks like you did such a good job with your presentation. There weren't as many questions. But yeah, that's all we have for you today. Big thank you to everyone who joined us. This talk, along with previous talks we've done, will be posted to our YouTube channel soon. So search Showhead Ear Associates Medical Group on YouTube to check that out. And if you'd like to share with someone you know, keep an eye on your email inbox. We'll also be emailing a video recording of this talk out. And it looks like as I was talking, we got a few more questions. So I'm going to go ahead and turn it back over to the speakers to answer those last couple of questions.
Let's see here. Looks like, will it work if you have a problem with wax buildup? The best part about lyric that my patients say is that they get to get their ears cleaned a little more frequently. So every time lyric comes out, we want a really clean ear before we put a new one in. So if wax is an issue for you, the only thing I could really foresee would be, maybe coming in a little bit more frequently to change the lyric, but you're always getting a clean ear before a new one gets put in, which is really helpful. And then another question, did I hear correctly that to have an MRI, it must be removed? And yes, you definitely want to take out lyric before getting an MRI. But again, with that subscription, it's nice. You can come right back in and get a new one put in, even same day after your MRI. So taking them out frequently is not really an issue. You'll just have to visit me a little bit more frequently. Any other questions?
All right, everyone. We look forward to connecting with you again next month. And until then, we encourage you to get connected. Follow us on our social media channels. For Instagram, it's ear_doctor. And on Facebook, I think we have a slide for this at the very end. You can follow us there as well, and for updates on what's going on and the latest with our practice. We hope everyone has a great day, and thank you again for joining us.